Welcome to our program. I'm Frank Long, Editorial Director of Rehab Management. Long COVID is a term growing in familiarity among rehab professionals. Outpatient therapists were among the first to see and deal with the long-term effects of COVID-19, and they are no strangers to the lingering debilitation it can cause. On this program, we're going to dig into the phenomenon of long COVID and look at details that are of particular concern to rehabilitation therapists. We'll get a better understanding of how and why neuroplasticity treatment works for long haul COVID patients. We'll also look at brain training, and we'll look at the dangers of leaving the conditions associated with long COVID untreated. Joining us for this discussion directly from London are two experts in long COVID treatment, Dr. Tina Piers and Ashok Gupta. Dr. Piers is a physician who has developed the Piers protocol for long COVID and has been helping manage COVID long haul patients for quite some time. Ashok Gupta is the clinical director of the Gupta program, which is devoted to treating a variety of conditions that includes post-COVID-19 syndrome. Both are featured speakers at the International TLC Conference taking place June 19th and June 20th. The conference is described as one of the first to gather experts from around the globe who are currently studying or developing treatments for long haul COVID. Dr. Piers and Ashok, welcome to our program.
Thank you for inviting us.
I'd like to begin with a question about the science and research behind long haul COVID. What precisely is happening in the brain's amygdala and insula?
Yeah, so we describe kind of COVID-19 or long haul COVID as this kind of hidden pandemic. Yeah, there are millions of people suffering from it. And in our estimation, anything between 10 to 30% of patients who've developed COVID-19 go on to develop long haul COVID. And there are many different theories out there about what causes it. Our personal view here at the Gupta program is that it is actually caused by an imbalance in the brain. So when somebody contracts COVID-19, it is obviously life-threatening. And if the brain perceives that the immune system is weak or isn't able to fight off COVID-19 completely, the brain may go into an altered state, a malfunction as it were, and decide to continually overstimulate defensive responses. So the brain still believes the COVID-19 infection is still in the body and therefore keeps over-responding, which creates the symptoms in the body. And the brain takes those symptoms in the body, specifically the amygdala and the insula, it perceives those symptoms in the body as representative of COVID-19 infection still being present, therefore stimulates the body again, and we go around in a vicious cycle. So the body and the brain keep reacting to each other, causing this lack of homeostasis. So that's one hypothesis as to what may be causing long haul COVID.
What about neuroplasticity? Can you tell us how and why neuroplasticity treatment works for long haul patients?
It essentially identifies which part of the brain is malfunctioning or over responding. And a patient is taught how to potentially control those overreactions. Now, those overreactions are unconscious. We can't day to day control our immune system directly. But what we can do is teach our brains that we are no longer in danger and that these responses are no longer appropriate. And that's what the aim of neuroplasticity or brain retraining treatments is to enable.
I'd like to ask about brain retraining in the context of long COVID treatment. What is it and how is it effective?
So that's where we enable a patient to recognize some of those unconscious signals. And I'm sure, many of your therapists and trainers will recognize that when people have these types of conditions, there's a large amount of anxiety potentially in those patients, or certainly a lot of concern about how they're going to manage and deal with this condition. So we teach a patient to recognize some of those unconscious lack of safety triggers, as it were, and then to retrain them using specialized techniques that we spent the last 20 years refining. And most of these treatments have been previously used to treat ME and chronic fatigue syndrome and fibromyalgia. So those particular conditions we find have a lot of crossovers with long haul COVID. So we have the experience of treating that and therefore are applying it to these types of conditions.
Let's shift gears for a moment and talk about chronic fatigue associated with long COVID. Dr. Piers, can you share some of the ways that chronic fatigue sufferers can manage their illness?
So I see a lot of chronic fatigue patients when I see my mast cell activation patients in my clinic, and my approach is very complementary to the brain retraining approach. So in chronic fatigue, what we believe is happening is that the patients have dysfunctional mast cells, so they have an overreaction to infections and to various environmental triggers. So that can be pollution, it can be stress, and it can be viruses. So often people experience the chronic fatigue syndrome after they've had a viral illness like Epstein-Barr or chickenpox or coronavirus. And the way that we manage it is to treat them as per mast cell activation and to also support their systems and their metabolism in dealing with all the toxins that they're producing, and to also help them to pace themselves gently with exercise. So the kind of exercise that they tolerate the best is going to be things like Pilates and yoga and weights. Anything cardiac seems to stimulate the mast cells and make their condition worse. So this is a very important aspect, not just for ME patients, but for the long COVID patients, because they seem to be, there's a huge overlap between the groups.
What are the dangers of leaving long COVID untreated?
Well, if you have dysfunctional mast cells that are oversensitive and on red alert the whole time, their tendency is to become more and more and more sensitive. They start off with being a bit sensitive to exercise and maybe pollen, and then a few foods. And then as time goes by, they can become more and more sensitive, hypersensitive. And it becomes a cascade of chemicals released from the mast cells that will stimulate and hyperstimulate other mast cells to join in. So it becomes a sort of a bit of a tsunami, really. And by nipping it in the bud and treating it as early as possible, I think we'll get the best results.
And just to add to what Tina kindly said there, we also, in a complementary way, believe that if we leave long haul COVID for too long, what may happen is that the brain becomes entrenched in that type of response. Yeah, it becomes a habit. So the brain keeps responding in that way because that's what it's always done for 6 months, then a year, then 2 years, and 5 years. And that's what we see in many of our patients. So we have ME, CFS, and fibro patients who may have had the illness for 20 years, 30 years without any respite. And that's purely because the brain has become deeply entrenched. So the earlier we catch it, we think the easier it is to treat.
I'd like to wrap up this discussion by asking what insights about long COVID have been gained from researchers and practitioners around the world.
We initially thought that maybe there was viral persistence, but it seems that that's probably not the case. There might be viral debris left in the system, which is still stimulating the system. There's also the theory that the mast cells were dysfunctional in the first place. And I must say, out of the 70 long COVID patients I've treated so far, all of them except 2 of them have got previous undiagnosed and untreated mast cell activation, which they've had for decades. And then this is just another stimulant that's caused the symptoms to get much worse in them. So there's all sorts of theories. We're not sure whether it exacerbates mast cell activation, and in some people it causes mast cell activation. And as Ashok says, once this pattern of behavior becomes entrenched, then calming everything down with the neuroplastic retraining and with the medication and the approach that we take is very, very effective. They will have many varied symptoms. Fatigue and brain fog are 2 of the most common, and insomnia and anxiety. And then they will have symptoms in lots of different systems of the body. So they might have palpitations and low blood pressure and tachycardia. Then they might also have IBS type symptoms with bloating and diarrhea, constipation, abdominal pain. They might have rhinitis, so shortness of breath. They might have rashes and hives and urticaria and itchy skin. So there's so many different systems affected. And that's because there is hyperinflammation. And the mast cells release cytokines, which cause the inflammation, which can affect so much of our body and different systems. So don't be confused by all the different disparate symptoms that are going on, because they could easily have the same cause. So that's the first thing. What I always advise my patients to do is to go on a low histamine diet. And this has been incredibly helpful, because one of the amines that is released by the mast cells in massive quantities is histamine. And histamine will then cause the vasodilatation, which causes the headaches, causes the itchiness, etc., etc. So if we can reduce the amount of histamine going into the body in foods, then we can start to reduce the histamine load. And then if we can give them antihistamines, which can be bought over the counter, type 1 and type 2, that can also calm down and reduce the histamine load in the body. And then there are various other approaches that we take with a mast cell stabilizer, maybe, etc., etc. But these approaches can be incredibly helpful. And I would suggest that people try them as soon as they realize that their symptoms are continuing on beyond 3 weeks after a COVID infection. So that they try and get it under control as much as possible. We also advise various vitamins and minerals, again, which can be bought over the counter, to support their systems and help them to cope with some of the chemical imbalances that are going on as a result of the cytokine storm. And it's been incredibly helpful. Some patients get better within a week. Others, it takes a bit longer. And certainly when I see a lot of my patients that their 6-week follow-up, they are definitely going in the right direction.
I've been speaking with Dr. Tina Pierce and Ashok Gupta. We have more information about them and about the International TLC Conference on the landing page for this video. Dr. Pierce and Ashok Gupta, it's quite late in the United Kingdom at this hour, so I'd like to extend a special thanks to you both for putting in such a long day to join us. Thank you.
Thank you so much.
Thank you.